Hello, good morning, everyone. Thanks for joining us today. So, before I let you know what's my topic for today, I'm just going to try to share with you some scary statistics or scary facts first. Let's say we have a substance, let's call it substance X, and this substance is going to cause all these things to you. You still dare to use this substance? So let's go through this one by one. It kills more than 8 million people each year worldwide, and it kills more than 27,000 people each year in Malaysia. Accounts for more than 16% of all death in some countries. 16% means 1 in 6. It's the same thing accounts for more than 22% of all cancer death in Malaysia. So it's about 1 in 4 or 1 in 5 cancer death in Malaysia. And it contains more than 4,000 types of chemical, including ingredients found in rat poison, lighter fluid, battery, embalming fluids, etc. So you know what's embalming fluid, right? Yeah, basically it's the fluid that you use to preserve dead bodies. So are you going to consume all these chemicals? Yeah, intuitively you are going to say no, right? But do you know that many of you are actually doing it? So I'm going to proceed with my talk. So smoking kills, basically. Yeah. So the main title, the actual title for my talk is How to Stop Smoking, and this is being done in conjunction to World No Tobacco Day. My name is Dr. Kong Wei Yan, and I'm a consultant physician and nephrologist, and one of the co-founders and visiting doctor for Elder Love Living Care and Rehabilitation Center. So these are the outline of my talk, and of course, if I'm just going to talk about how to stop smoking, it's going to just be a 3 minute, 2 minute talk. Of course, I'm not going to do that. So I'll give you some brief idea about smoking in general. So what is tobacco? Tobacco, as many of you know, is a plant, with leaves that have high level of nicotine, which is a very addictive chemical. So after harvesting the tobacco leaf, it is being cured, aged, and processed in various ways. So the resulting products might be smoke in terms of cigarette, cigar, pipes, or applied to the gums or inhale. So that's why in our hand there is anatomical structure by the name of anatomical snuff box. It is right over here. Yeah, it is being called a snuff box because historically people put substance here to be inhaled, and one of the substance is tobacco. So cured tobacco leaf and their products contain many cancer-causing chemicals, as I mentioned just now. Even secondhand tobacco smoke have been strongly related or linked to many type of cancer and other diseases. So if you are a smoker, you are not only harming and trying to kill yourself slowly, but you are killing your loved ones slowly as well. So this is raw tobacco leaf on the left and the cure or processed tobacco leaf on the right. So definition of smoking. When people smoke tobacco, they burn it so that they can breathe it in or taste the smoke. Yeah. So people smoke tobacco in different ways, and of course, the most common and the easiest method, so-called method, is smoking a cigarette. Then you can wrap tobacco in a roll of paper as well. I have seen it before, of course, when my grandfather was smoking. Yeah, many years ago, he used to wrap the tobacco leaf in a roll of paper and he starts smoking. And of course, you can smoke cigar. Then tobacco can be wrapped not only in a roll of paper, but it can be wrapped in tobacco leaf or paper made from tobacco pulp. This is something rather new for me actually. And then of course, you can put loose leaf tobacco and you smoke it in a pipe. Yeah, just like what the Popeye does. Yeah, you have seen the cartoon, right, Popeye? So the character is doing this. So tobacco smoke, of course, it affects our health. And as I mentioned just now, even if the smoker doesn't breathe in the smoke will still affect people around through secondhand smoke. And now there's a new concept of third-hand smoke. Of course, I'm not going to go deep into it. So what is secondhand smoke? Secondhand tobacco smoke is the smoke emitted from the burning end of a cigarette or from other smoked tobacco products, and the smoke exhaled by the smoker. More than 4,000 chemicals have been identified in tobacco smoke. Yeah, whether you are actively smoking or the secondhand smoke, and there's no safe level of exposure to secondhand tobacco smoke. So in other words, if you go to an eatery and someone's smoking beside you, you are actually going to receive some harm from the person next to you who is smoking. So the smoke will harm people around the smoker, including pregnant women and the babies they carry, of course. So I'm going to give you some more scary statistics about tobacco smoking. So let's start with the worldwide. Yeah, what's the statistic worldwide? So in 2020, 22.3% of the global population used tobacco. So of course, as you can see from the numbers, there are a lot more men smoking as compared to women. So 22.3%, what does that mean? It means that 1 in 4 to 1 in 5 people in the whole wide world is smoking. So tobacco also kills more than 8 million people each year. So what's the concept of 8 million people? To put in the perspective for you, so 8 million people, our country's population is about 33 million in Malaysia, right? It means that every year there's almost a quarter of the number of people in Malaysia can die from tobacco alone. So, and also to put in this perspective for you, COVID-19 so far in the past 2.5 years has killed about 6 million people in 2.5 years. Tobacco can kill 8 million people in just 1 year, and this has been ongoing for many years, resulting from the tobacco. So, out of these 8 million, 7 million of those deaths are result of direct tobacco usage, and another 1.2 million, these people are more innocent. Yeah, they are being killed indirectly by their smoker friends or family. So it accounts for more than 16% of all deaths in some country. So again, like I mentioned just now, 16% means 1 in 6 people die. In some countries due to tobacco. So how about Malaysia? You think Malaysia is very far off from what the world is doing to harm themselves by using tobacco? No, Malaysia is actually doing slightly worse as compared to the whole wide world. So about 5 million adult, which is 22.8% as compared to the worldwide statistic of 22.3%. Adults, yeah, were current smoker. It's significantly higher in males as compared to females. And then, if we are going to compare the ethnicity or race, Chinese and Indian have had a significantly lower prevalence of smoking as compared to other ethnic groups in Malaysia. 25 to 44 years old is the age category that is reported having the highest prevalence of smoking. It kills more than 27,000 people each year in Malaysia. So COVID-19 in Malaysia has killed about 30 over thousand, 33,000 if I'm not mistaken, in 2.5 years. So you're all getting all worked up and excited and scared of COVID-19. But why are you not scared of tobacco smoking, which kill at least double the amount of people, yeah, per year. So again, it accounts for more than 22% of all cancer death in Malaysia. So what are the adverse effects of smoking? So everybody knows, but I'm just going to elaborate a little bit more. So what is so addictive about this cigarette smoking or tobacco smoking? Because it contains the main chemical of nicotine. So nicotine is a dangerous and highly addictive chemical. It's not only highly addictive, but it is dangerous to our health. It can cause an increase in blood pressure, heart rate, narrowing or hardening of the blood vessels, yeah, which in turn may lead to heart attack, stroke, and whatnot. So this chemical can stay in your body for many hours depending on how often you smoke. Also, as with most addictive substances, there are some side effects of withdrawal. So, beside nicotine, as I mentioned, there are more than 4,000 types of chemical, yeah, that you can actually find inside a cigarette. So, these are some of them. I'm just going to tell you one by one. So, it contains carbon monoxide, yeah, which is the same thing that released in car exhaust fumes. So, and I'm sure you have read stories that people can pengsan, or collapse in a car if they keep the engine on without opening the window, right? Because of carbon monoxide poisoning. But you are doing exactly the same thing when you are smoking cigarette. And then it also contains cadmium and lead. Are you going to eat a battery? I'm quite sure you are not going to eat a battery. But why are you smoking? Yeah, because you are basically consuming the same chemical as in battery. So other example, tar. Tar is material for paving roads. Tar, right? The blackish thing that you find on the road. You're going to sit down or in the on the road and lick on the tar that the workers lay down. No, I'm quite sure the answer is no because you're sane, you're not crazy. But why are you consuming tobacco? Because you are doing the same thing when you are lighting up a cigarette. They are almost the same substance when you light up a cigarette. End product contains some tar, which is almost the same thing. Yeah. So remember, for those of you smoker, when you smoke for quite a prolonged period of time, for years or months or decades, you have some staining on your fingers, right? So those are tar staining essentially. Yeah. And when you see photos of blackish lungs in some smokers, basically those are tar. Yeah. So one more scary example is arsenic, which is found in rat poison. So when you are lighting up a cigarette, there's no difference between lighting a cigarette and smoke, and also consuming some amount of rat poison. Last but not least, cigarette also you can actually find formaldehyde in cigarette. So it is actually the chemical that you use to embalm dead bodies. Yeah, so the same thing you're consuming when you're lighting up a cigarette. So adverse effects of smoking. So cardiovascular, I think I mentioned some already. So smoking basically damages blood vessel and can make them thicker and grow narrower. So this make your heart beat faster and your blood pressure goes up. And clots can also form inside the blood vessel if you keep on smoking. So this event cause stroke and heart disease, for example, heart failure and heart attack, which are among the leading causes of death in the developed and now even in the developing countries. So even people who smoke fewer than 5 cigarettes a day can have early signs of cardiovascular diseases. So you don't even have to be a heavy smoker to cause the harm. So blockages caused by smoking can also reduce the blood flow to your legs, which is what we call peripheral arterial disease, which can result in amputation. So this is just a diagram or cartoon, yeah, of what I just elaborated. So how about to the lungs? Yeah, respiratory system means the lungs. So smoking can cause lung disease by damaging your airways and the small air sacs, what we call alveoli, found in the lungs. So lung diseases caused by smoking include COPD, or what we call chronic obstructive pulmonary disease, and also lung cancers. And there are multiple other types of lung diseases that are related or linked to cigarette smoking. And then smokers are 13 times more likely to die from COPD as compared to non-smokers. And smokers are also a whopping 30 times more likely to die from lung cancer as compared to non-smokers. So, and if you have asthma, tobacco smoke can trigger an asthma or make the control of asthma worse or make the asthma attack worse. So just want to show you some photos. On the left, you have two pieces of lungs. One is healthy human lung, another one is tobacco smoker's lung. See the blackish material over there is basically years and years of tar accumulation. Yeah, as I mentioned, it's no different from the tar that they are laying on the road for pavement, for to pave the road. Yeah, so it's the same thing when you are smoking. So, and on the right, you have a cartoon, you have a diagram that shows a comparison between the healthy lung and also lung in a patient with chronic obstructive pulmonary disease. So as you can see, for patient with COPD, they have got all the narrowing of their airways, and then the alveoli, are all inflamed and obstructed and destroyed by all these smoking processes. So the COPD patient usually can't breathe, and they have a lot of cough, and when they cough, they have a lot of secretion of phlegm. Yeah. So, some more adverse effects of smoking, and of course, cancer related due to the so called carcinogens in cigarette. Carcinogen means substance or chemical that can lead to cancer. Yeah. So, as I mentioned just now, there's about 4,000 types of chemicals inside a cigarette, but there are almost 70, more than 70 times of known carcinogens. Yeah. So, out of these 4,000 chemical, at least 70 of them are well known to be able to cause cancer. And look at the list, of possible cancer, and look at this, lungs, bladder, even blood cancer, cervical cancer, colorectal cancer, esophagus cancer. Esophagus is your food pipe. Yeah. Kidney and ureter cancer, larynx cancer, liver cancer, cancer of the oral pharynx, for example, throat, the tongue, the soft palates, and tonsils. Even the pancreatic cancer and stomach cancer have been associated and linked with cigarette smoke. So on the left, you have a picture of lung affected by lung cancer. And on the right, try to look at these two ladies who have throat cancer and facial cancer. Yeah, the lady with a red shirt, try to look at the face. Yeah, her photo is not edited. Yeah, we do not Photoshop it. Her face is looking like that because she has got multiple surgery due to oral facial cancer related to smoking. So smoking basically harms nearly every organ of the body, beside the lungs and the heart, and also the all the cancer causing danger. So, for example, active smoking or secondhand smoke can make it harder for a woman to become pregnant. It can also affect her baby's health before or after birth. So they can have early delivery, they can have stillbirth, which is death of the baby before birth. It's a very, very unfortunate event. So low birth weight, sudden infant death syndrome, ectopic pregnancy, or oral facial clefts, yeah, in infants. Smoking not only can affect the woman to become having all these problems that I mentioned just now, it can also affect a man's fertility by reducing the amount and quality of their sperm, causes erectile dysfunction, and also increase the risk of birth defect and miscarriages. Yeah, because all the chemicals in the cigarette can alter the DNA and causing all this birth defect and increasing the risk of miscarriages. So I'm quite sure you are familiar with these two photos, right? These two photos can be found in our boxes of cigarette. So the first one, the top one is premature birth. Look at how this little baby is suffering. And the second one is stillbirth, essentially death of the baby before the baby was even being born, just because of their smoker father and mother. So adverse effect of smoking, these are just some more list, yeah, for your knowledge. Smoking can affect the bone and causes fracture. Smoking, of course, can affect the teeth and gum. Smoking can increase your risk of becoming blind. Smoking is strongly associated with diabetes mellitus. Smoking can cause general adverse effect on the body, including inflammation and decreased immune function. So a chronic smoker, can get infection easier as compared to other people. So how is Malaysia doing combating the smoking problem? Actually, honestly speaking, Malaysia, for me, in my opinion, is doing very good, yeah, in terms of trying to combat the smoking problem. So, beside imposing tax, the Malaysian government has, in 2010, implemented pictorial health warnings in cigarette boxes. Yeah, I've just shown you two regarding the babies, and then one of the picture also show lung cancer. Another picture is also showing throat cancer, if I'm not mistaken. And one other picture is showing amputation of the fingers, if I'm not mistaken. And in 2015, the Malaysian government has raised the minimum age for purchasing tobacco products from 18 to 21. And in 2018, just a few years ago, it has gazetted more areas as non smoking zones. I'm quite sure you and I remember this, right? It causes a big hoo ha at the time, especially from the smoker who doesn't agree with the new rule, but it got implemented anyway, yeah, to protect the vast majority of the non-smokers. So, this year, our health minister Kari Jamaluddin has announced in one of the UN Assembly that the government is planning to introduce new law to ban smoking and the possession of tobacco products for people born after 2005. Yeah, basically it will act as a generational endgame for smoking in the country, and I hope this is going to be really implemented in the end of this year or the beginning of next year, as promised by our Minister of Health. So, how to stop smoking? You Again, as I mentioned to you just now, this is the title of my talk, and of course, I'm not going to just give you a few slides and get done with it. So that's why I decided to, give you some information and try to empower you with all the statistic and information about the danger of smoking over the past 20 minutes. So now, try to talk about how to stop smoking. So I'm quite sure you have encountered some friends or family who try to stop smoking, but they fail, and they try again and they fail again, and things like that. So why is it so difficult to stop smoking? One of the main reason is because nicotine is highly addictive, and stopping it will cause withdrawal symptoms of varying severity. So this is a list of withdrawal symptoms, yeah, and the list doesn't end there. Basically, you can take a look at it. So people can feel craving for nicotine. They can have severe headache, nausea, dizziness, feeling anxious or feeling frustrated or even depressed, trouble sleeping, trouble concentration, with concentration, feeling tired, restless. Yeah, some people will have increased appetite and gain weight. Yeah, so constipation, gas, diarrhea, chest tightness, post-nasal drip, sore throat, and the list go on and on. That's why it is really not a funny feeling when a person is trying to quit. So that's why a lot of failures there. So and there are actually many ways that you can use to try to quit smoking. So number one is of course pharmacological ways. So not all smoker or ex-smoker, shall I say, need this. A lot of ex-smoker actually they quit their smoking just out of willpower and a few other things that I'll mention later. But there are multiple medication that we can use to assist a smoker from quitting smoking. So the first one is, of course, NRT, what we call nicotine replacement therapy, is available in lozenges form, gum, basically it's like a chewing gum, or skin patch. A lot of these lozenges or chewing gum and skin patch are already available over the counter in many countries. So, but you can have oral inhaler or nasal spray, but most of these are going to need prescription. So how about NNRT? Over the past many years, there are many medications came out, and two of these has been proven to be beneficial in assisting people to quit smoking: bupropion and also varenicline. So of course, you need to discuss with your doctor or pharmacy regarding this. And in fact, many people do not know this, but most of the government hospital and most of the clinic kesehatan, they will have some certified people to help you quit smoking. So how about non-pharmacological? I'm going to breeze through this. There are a lot of ways that you can try to use. So first of all is of course avoid trigger. Yeah. So identify the common time or place where you usually smoke, which is called the trigger, and try to get through them without using tobacco. Yeah. So delay. So first of all, when you're craving, when you're trying to smoke, when you're trying to quit smoking, try to delay it for 10 minutes and then 20 minutes and then half an hour and then 2 hours and something like that. Yeah. So the longer you go, the longer you don't feel like smoking anymore. So, or you can try to do something to distract yourself, or when you're craving, go to a public non-smoking area so that you have the legal obligation not to smoke. Yeah. So and chew, yeah, and give your mouth something to do. For example, chewing some candies, chewing some healthy snacks, and so on. When you have a tobacco craving, when you're trying to quit smoking, and then tell yourself, don't have just one or the last one, because having just one will lead to one more, of course, as you know. Get physical, it means try to do some physical activity, because it can distract you from tobacco craving. Even short bursts of physical activity will do, will be enough to take away your craving. If you don't like activities, of course, you can try, to say a prayer and doing some housework, for example, cleaning the house and whatnot when you're craving. So try relaxation techniques, which include prayers, deep breathing, muscle relaxation, yoga, visualization, massage, or listening to calming music. So of course, social support is very important. As I mentioned, a lot of people can quit because of support from their family and friends, and there are multiple support group. For those of you smokers out there who is planning to quit, do check this out. There's a very well established Quit service, and you can see the website from here. It's a service established about 6 or 7 years ago. It's a collaboration between the Kementerian Kesehatan and also the Association of Pharmacy. Yeah, so a lot of pharmacies are actually trained or certified members in helping people to quit smoking. Yeah, do ask around or just go to this website. In this website, on the right hand corner, you can register to be a person who is interested in quitting, and they'll contact you and they'll assist you with all the necessary steps. So there's a report that says that almost one third of people in Malaysia who successfully quit smoking, they quit because they are using this Jom Quit or M Quit service over the past few years. Yeah, do try it out if you're interested. So of course, you can remind yourself of the benefit, of quitting smoking. You'll feel better, you'll get healthier, you'll get even richer, yeah, because you're not going to burn money by burning cigarettes anymore. and you can spare your loved ones from secondhand smoke. Yeah, these are the most important things. So I think this would be my last slide. So what would be the benefit of quitting smoking? Yeah, so for those of you who are really interested in quitting smoking, do take this as a take home message. Yeah, so I'm going to go through this with you. So after you stop smoking for 8 hours, you will have an improvement in blood circulation, yeah, due to reduction in nicotine and carbon monoxide level. And then after you quit for only 1 day, your body can eliminate a large portion of the nicotine and carbon monoxide. After 2 days, you'll feel improvement in the ability to taste and smell. After 1 month, you'll see some improvement in your skin radiance and texture. After 3 to 9 months, you notice a decline in coughing and wheezing. And after 1 year, there's a reduction in the risk of heart attack by 50% compared with that of a smoker. After quitting for 10 years, you essentially reduce the risk of you getting lung cancer by half. And then after 15 years of quitting smoking, multiple research have shown that an ex-smoker can have a reduction in the risk of heart attack to the same as someone who never smoked before. So it's never too late to quit smoke. So I think this is my last slide. With that, I thank you for all your attention.